I could turn your headphones up, or is that too much for you?
That's okay.
You sure?
Yeah.
I gave you one little click up.
That one little click's good.
Okay. All right, Frank, I'm going to take you off the air. You can be able to see us and stuff, and then we're going to get started with the show and the opening and stuff, and then we'll bring you on, okay?
Okay, sounds good. Thank you.
You're welcome. Sure thing.
That made a big difference.
I think he might have did something on his end, too.
Okay.
Do you see all those books behind him?
Yeah.
I read about 2 of those books.
Oh, okay. I thought you read all of them 3 times.
No, I read 2 of them. The blue one and the red one. That's the only 2 that I read behind
looked
them.
to see what kind of pictures they had in them.
They got, there's little stick drawings and stuff.
Yeah.
I could probably draw better pictures, but still.
Yeah.
All right, Mike, you ready?
Yep.
All right, here we go.
And now for something special. The unit is self-contained with its own saddler, farrier, wheelwright and so on. It's a rigorous training dished out who know all there is to know about horses, and it brings results.
We take you behind the scenes now to show just some of the interesting aspects of this training.
Welcome back to Equine Dynamics with Mike Stine, the #1 podcast to create sounder horses from the ground up. Mike Stine is a registered journeyman farrier with an APF 1 accreditation. On this week's show, a doctor of veterinary medicine, we have here in the studio Dr. Frank Reilly, and he's going to discuss the importance of COPD, asthma, and breathing effects of feet, canker, laminitis, and insulin resistance. All this and much, much more will be discussed here on Equine Dynamics with Mike Stine, and over my far right side is Mike Stine. How are you?
I'm doing good. How are you doing, Travis?
I'm doing all right. Hey, look, I'm back from, where am I back from?
Where are you back from?
I'm back from, we went to Alaska.
Yes, you did.
And boy, are my arms tired.
Yeah, you didn't go out and get you some pictures taken with some little baby bears, did you?
No, we didn't see any bears. We saw some whales. But there's one thing that the whole entire time I was in Alaska, we went to Juneau, Skagway, and then what's the last? Ketchikan were the 3 ports that we went to, and we saw the glaciers and everything while we were out there. But one thing that I did come across was the whole entire time we were there, I didn't see any horses at all. And I would think that they would have at least...
There's some horses in Alaska.
Well, we took a train ride on this one trip, this one excursion that we went on to, was a trip that was called the White Passage to the Summit. And coming to find out the history, they had this whole huge gold rush, in the 1800s. Right. And this White Passage to a summit, which is higher up in Canada, was a long, treacherous trail. So all the people were called stampede. And I always thought that was like a rush of horses, but they called the people themselves stampeders. And they packed their animals. They had mules. They had goats. They also had a lot of horses. But what I found out was they had this one place where the trail actually met the train that was going into Canada.
Right.
So once the trail met the train, they pulled off all their gear, all their food, all their supplies and everything and put it on the train. And, this is a 5-day trek to get to this point where the 2 meet.
Right.
And then they literally pushed the horses off into a ravine. They either shot them, they pushed them, because it was cheaper to buy another horse at the other end of that trail. And I'm sitting there going, well, that's horrible.
Right.
And so it's this huge ravine, and you didn't see any bones or anything down there. But, on this trip, they never fed the horses. It was cheaper not to feed them. It was cheaper to have them just...
There wasn't much horse left by the end of the trip.
Exactly. And it was just amazing that, us as humans would do something to an animal like that, even if it's a pack animal, even if, treating them with somewhat...
some respect,
some honor to them, but no, they said that they would just bang right in the head and push them right over this down in this gulp.
Kind of like how you treat me normally, right?
No, not like that. But I mean, it was eye opening that we as you don't think of us as humans doing that. Now you think of humans doing bad things,
right?
But it was just kind of like, oh wow, that's how many horses are down there, how long was this going on before someone actually put a stop to it? Because like I said, it was just cheaper for them to buy another horse on the other end. And just to give you an idea, it costs $3 for them to put all their gear and stuff on this train to get it across the Canadian border,
right?
And then which is equivalent to $300 this time, or in this day and age, and then buy another horse on the other side. So it was just a sad story. It's just something that I learned, the history of horses, that they weren't, taken very good care of in the gold rush. So what's been going on with you, Mike?
It's heating up, working, getting some miscellaneous calls, and talking about the canker, I did have somebody send some pictures with a really mess of a horse, but they've gone on with other directions. That's fine. And I was hoping that you would find some baby bears and get you some pictures.
No.
The mom would be okay.
No,
mom would be okay.
We saw whales, and we saw they had a lot of bald eagles up there. I didn't realize how
But
many bald eagles they had.
I'd given you a picture of a water trough, right?
Yeah, here, let me switch screens here. And don't forget, for every podcast, we do have a matching video over on YouTube. Just search Equine Dynamics Mike Stine, and make sure you subscribe to him over there, and you can see all these pictures, and you can see Frank Reilly, Dr. Frank Reilly here in just one sec, with all his pride and glory on the screen. But I'm going to switch over to this screen right here, and this is a water trough, Mike. Tell me what I'm looking at here.
This is a water trough. This is
Looks like someone just mowed the grass, and all the grass is blown into the water trough.
They did, and there's a few things growing in there and all that sort of deal.
So why is this important? Why am I looking at this?
Why are you looking at it? It's getting hot. Horses need good, clean water. If they're not drinking enough in this hot weather, they can get trouble. And, the sad thing is this is a situation where somebody has paid a pretty substantial amount for board. And kind of wonder how much attention is being paid to that. And like when it's getting in the 90s and high humidity, water is important for a horse.
Right.
So that's all I got to say about that.
So I know my wife, when we got back from Alaska, the first thing that she did is she walked right out to the horse trough, and she's like, "Oh wow, it's kind of dirty." She dumped
doesn't take long.
cleaned it out, and then we went on.
It doesn't take long this time of year for stuff to start growing in there.
So make sure you have your water troughs clean, especially this time of year for all the hot ponies out there. All right, guys, we got a big show to get into, lots to talk about, and we're going to have Dr. Frank Reilly come on and tell us all about what we need to know about asthma and how breathing affects the feet. So stick around. You're listening to Equine Dynamics with Mike Stine. He'll be right back. Let me bring Frank on real quick.
Right. We got to do a little.
Yeah. Oh, yeah.
Stuff.
I'll make sure I do that. I got to fix one. Hi, Frank. I got to fix one thing. Welcome back to Equine Dynamics with Mike Stine, brought to you by Natural Hoof Dressing from Equine One. Go to equine.one and get 10% off your hoof mender or hoof dressing with the keyword podcast. Just go over to equine.one and get 10% off all your hoof care needs over at equine.one with the keyword podcast. Thank you, Mike. You look beautiful over there.
Yeah.
And over my far hand side, being our own little Vanna White over there, is Mike Stine. How are you?
I'm doing good. How are you? And how are you, Frank?
And joining us What? What'd you lose?
He talked.
And joining us this week is Dr. Frank Reilly. How are you, Frank? Well, thank you very much for joining us. I was talking about all the books and stuff that are behind you. Where are you located right now? You look like you're in a library or anything like that.
Know everything. You can go online, but I like to be able to every once in a while go back to a book that kind of see some of the old school ways and how we've improved. And so I just kind of collect them over the years.
Well, you got quite a collection behind you. So we brought you on this week because you heard the story about Mike Stine and that water trough and how important it is to keep horses hydrated and stuff. But you actually want to talk about how the importance of COPD, asthma, and the breathing effects and how it affects the feet of a horse. So are we worried about that now, this time of year, or is this a year-round thing that we're looking at?
Well, I mean, I'd say the peak is now simply because the pollen counts are up high. And so you're going to be getting horses with allergic airway diseases, and then what happens with these horses often is it starts out as seasonal, a couple 3 months a year, and then it goes to 4 months and 6 months, and then all of a sudden it becomes year round. So as they get older, these horses get their asthma, COPD when they're usually starting around 14 years old. So it's not like children where it's early, and so all of a sudden, for some reason, my horse is having problems with breathing. And he's never had a problem before, and then all of a sudden you have these issues that you have to deal with. And then in this time of the year, it gets even worse. As Mike had said, what starts getting hotter is that these COPD asthma horses all have broken cooling systems. And so you'll see these horses doing nothing, just sitting in the field, just puffing. And like they just ran the Kentucky Derby, and they're doing nothing. And so then people think, oh my God, my horse is having an allergy attack and I got to call the vet. And Then they'll come out, they'll treat the horse, and he'll be better maybe for a very small period of time. And then in the 2 or 3 days later, he's back to continually puffing and being stressed. And of all the problems in horses, I'd say it's probably the most stressful on owners, because your horse is basically half suffocating. And
Wow.
and it's day after day after day, and the horses are being treated with multiple things, and often really are not. It's difficult to get these things kind of under control. And so we've been working on these kind of horses for a while, and we learned very quickly that all of a sudden these horses would be treated by the veterinarian or with different medications, steroids, for example. And then all of a sudden, 3 days didn't work, we'll do 2-3 weeks. And all of a sudden they're on them all the time.
Right.
And then all of a sudden, boom, horses in laminitis.
I was going to say that leads into a big mess.
Yeah, it does. And so all of a sudden you've got this breathing problem turning into a foot problem, where all of a sudden it can, both of them can be very life-threatening. So all of a sudden I would have farriers, this was probably a good 15 years ago, saying, I'm noticing these bad breathing horses almost look like they're always in laminitis. They're not crippled sore like, a full-blown acute case, but their foot quality is horrible. They're getting rings, and what's going on here? And so we realized that it wasn't just them being on steroids. It was that there were other things in play. The steroids just made them worse and come on faster. And so actually the farriers were the ones like, what do you think? I'm like, well, I really hadn't even thought about it. And he goes, well, it's just the ones that I'm working under, and they're just like a bellows, trying to breathe. And I just think something's going to happen. So I'm like, well, let me dig out on that. I don't really know what's going on there. And so then we realized, of course, often they're on steroids, and that increases insulin, which then leads to insulin resistance, which is the number one cause of laminitis. And then they're on clenbuterol. And I had a client that we had been testing for insulin-resistant laminitis prior. I tested it, and it was perfect. Everything was great. And probably a month later, she's like, I think this horse is in laminitis. I'm like, what? We just did it. We're all on a great program. So we went out there, and she was absolutely correct. I'm like, well, anything changed? She goes, well, he was starting to breathe a little funny. So there was another veterinarian here. We started him on clenbuterol, which is a Venipullman bronchodilator. And it's a little mini, and it always been on that for 30 days. Do you think that caused it? I don't know. And there was nothing really in the equine literature about the effects of bronchodilators on insulin or being a laminitis trigger. Kind of a blank page. I was like, well, I don't know. So I had to dig in. And then through some human medicine, we were able to determine that, yes, bronchodilators also increase insulin resistance. So we then realized, wait a minute, we're getting, insulin-resistant jack up from steroids. We're getting insulin-resistant jack up from bronchodilators like clenbuterol or albuterol. Sometimes we would try inhalers, which are kind of goofy. Actually, a very large,
especially for a horse, sit there and go,
trying to get this puffer into their nose, and then quite honestly, wait a minute. I mean, the horse's neck is from his head down to his lungs is, a yardstick.
Right.
And,
right.
Don't tell me that puffer is going all the way down. It's nonsense, right?
So you brought up a whole bunch of different, a whole bunch of information there. And I'm like, ooh, I know that. Now, I don't know if you know this about me, Frank, is I am the simpleton of the show, right? So what you see is what I know right here in front of me. This is all I know. My wife is the one that rides. She's the one who does all the horses stuff. And I just learned through Mike and osmosis and everything. Now, you said that you were working on a mini. I've got a mini as well, and her name is Cayenne, and her mom did she have COPD?
She had some breathing problems going on.
She had a lot of breathing problems,
some laminitis,
and she would constantly like cough, like a dry cough, like allergies. And now this is being passed. She passed away, unfortunately, and now we have her daughter, which is Cayenne. And she's starting to do it now. And my wife says there's a couple things. She will buy allergy medicine, like the pills from Amazon, like the big bottles of like 750 pills, tablets,
yep,
and give the horse at least 6 or 7 of those. she also says she has to be careful about the hay that she gives Cayenne, because if it's cut too close to the ground, that dust or something in the hay, if she eats it, will cause the same thing. Now, should I be worried about that? Now, Mike does Cayenne's feet, and as far as we know, she really doesn't have bad feet right now.
Right now, we're doing pretty good. Her mom definitely was in laminitis. And to me, these horses, once they start going acute, when they've got, the breathing problems, it's just a tough deal. It's hard to ever get them to stabilize. It's just, that's been my experience. And I've brought it up with other people, and they're like, why do you think that's a problem? And same thing you were getting, right?
Yeah,
and,
what you're saying there, so there is no really one supplement or one drug or one management tool. It's a real gang tackling. You've got to do a list of things. And so, like you were just discussing, like with your hays, you get organic dust from the dust of how the hay was made or stored. And so all these horses will do flash soaking, where you'll put the hay in the hay net, put it in a Rubbermaid of water, brick on top, full submerged. People try to hose it down and sprinkle it, and it doesn't do any good. And then 10 minutes of full submerge, and that's why I call it flash soaking, not overnight, because overnight or even over an hour increases bacterial counts. So
I was going to say, it get all moldy and everything. My wife worries about that the most part.
Right. How do you feel about the steamers?
The steamers are good, but they're a couple $1,000, and so
for somebody like Travis, that's no big deal.
Yeah, I'll buy two. I'll buy two just in case one breaks down.
Right.
All right, guys, we're going to take a quick little break and come back and continue this conversation with Dr. Frank Reilly. So stick around. You're listening to Equine Dynamics with Mike Stine. He'll be right back. And now that you got the first segment jitters out, you're doing fine. Yeah, as much information as you possibly can, man. You're full of it, and I can tell.
We can go over like the protocols for these things to and how to avoid the laminitis without the steroids and the and your wife. We could go back to that because Zyrtec tabs from Costco, Walmart. That they did a study of that in horses, so that's the real deal. That's a legitimate, easy, cheap way to help these horses.
Okay, let's talk. Welcome back to Equine Dynamics with Mike Stine, brought to you by the all-natural hoof mender by Equine One and hoof dressing.
We'll do the
get yours right now. Go over to equine.one and put in podcast for 10% off your complete order. That's equine.one. Keyword podcast for 10% off. And over to my far hand side, it's 10% off right now, is Mike
That's
Stine.
Right.
How are you?
I'm doing good. And we got some brains with us today. We got Dr. Frank Reilly in.
And joining us here in the studio is Dr. Frank Reilly. Don't forget, we have, for every podcast we do, have a matching video over on YouTube. Make sure you like and subscribe over there. Dr. Frank, how are you?
They're good. Good morning.
Good morning. Thanks for joining us this week. So we were talking during the break there, and you can catch all this stuff, like I said, over on YouTube. We have these intimate discussions that sometimes don't make the main air, but it's great to go back over there and listen to all the chit-chat in between the show. You were talking about my wife getting what she was doing with Cayenne and getting these pills from Amazon. That you said that's the right thing to do at this point.
No, absolutely. So your management steps will push back this problem as much as you can. And so you're talking about your flash soaking of hay, and then number two step is we recommend Zyrtec tablets, cetirizine. You can get those generics at Walmart, Costco. Very, very, very cheap. And it's by the pound. It's milligram per pound. They did a study with horses, so it's not a bunch of hocus pocus. And this works, and then we don't know how much to give and all that. So we know exactly how much to give these horses. It's per pound. It's a little higher than for people. But again, these are very cheap horses. So like the mini horse would be 6 tabs in the morning, 6 tabs at night. And usually I'll only keep them on it for 7 to 10 days, kind of calm things down. And again, they're very simple to give. They're very teeny. You throw them in the feed. That's another thing when we talk about with foot, and another we'll move on with like concentrates is we like ration balancers with a little bit more protein. Why do we want that? We want to promote the breathing muscles. These horses' breathing muscles can be very stressed because with this problem, they double exhale, they breathe in, and then and so you see this kind of bellowing action.
Sounds like me in the morning. We're trying to get out of bed.
Same thing.
So we're doing, like we're self-flask soaking. We're using cetirizine. We're going to be using high protein balancers. There's a lot of those on the market now. The other thing we learned with this, regarding back to laminitis, another trigger, was that in human medicine that they were finding that a lot of people are on thyroid powder. And I was like, well, that's interesting. So we looked in and dived into that with these horses. We found that when we were testing them, all of them tested low normal. So they were normal, but they were in the very, very low end of normal, like a C- in high school. Sort of okay, you're getting through, but not ideal, suboptimal.
This guy right here, total C- through high school, all right? You were talking about the thyroid stuff. We do have a mare here on the property, and there is something my wife physically puts on, like the latex gloves, and it's a liquid that she pulls out with a syringe, and she says, I'm not allowed, not me, she says she's not allowed to touch it. It is somewhat of a thyroid, I believe, for the mare, and she kind of just squirts it over the top of the food. But she says it's very, very bad for humans to touch it, as far as like females touching it, I guess. Is that the medicine that she would have? Does that sound right?
There's a thyroid. For this particular thing, there's a thyroid powder, and that's very cheap and easy because it's 1 scoop a day. It's a powder, and it costs 30 cents. So we'll supplement these horses for bad breathing. What your wife was discussing is, she's very correct, is Regumate, which is Altrinagest, which is to help with managing the mare cycling, and also helps with attitude and attention.
Oh yeah.
So they're always in heat. They're looking over here and there, and so it's a great product for that. But you're absolutely correct. Wear gloves. I had a friend of mine, an equine dentist, that was working with these horses, and all of a sudden a lot of race horses and she started getting really sick. Went to the hospital, and they said, "My God, your hormones are all over the chart, and no wonder you're really sick." Well, what was happening was they were squirting this into the mouth of the horse at the track, and then half an hour later, she'd be coming in as the dentist with a bare hand.
Oh, geez,
in there,
not knowing,
all absorbing into her skin, and multiple horses a day, and she had terrible problems. So your wife is correct. You have to wear gloves, and you have to make sure they're either latex gloves that are really rubber,
right,
or
nitrile gloves or something.
Nitrile gloves, thank you. Yeah, nitrile gloves. But yeah, your latex, that hormone will go right through it,
right.
So you can't use those. So that's a very, very smart thing that she's doing there.
Well, that's also with some of the chemicals.
It's a good product.
Some of the build materials, as far as protecting yourself, you're better off with the nitrile.
So with cayenne, is this something that we're always going to have to deal with, or is there a cure? Is there an end of this story outside of a negative end, a positive end? Can we bring her back around to where she doesn't have the breathing problems? We can take her off the steroid or the allergy medicine. Is there an end result of this show?
A lot of times in horses in early stage, you will start getting, my horse has been great and completely normal 3-4 months, and occasionally something will pop up, and you'll put the genie back in the bottle, and maybe just go back with the soaking and the Zyrtec and the thyroid powder, and maybe some supplementations with like with vitamin E and things like this, and you can kind of get things tamped down, because the more you work at it, and management is easy and cheap and simple. So thyroid powder, 30 cents, in a mini, it'd be 1 scoop a day. So 30 cents a day, that's reasonable. Vitamin E, even high dose for a size of that horse, would be probably around 40 cents a day. So these are just pushing it back, and because Mike is correct. Once they really are a year-round puffer, those are really hard. All you're doing is just trying to bring it down a little bit. You'll never get them back to normal. It's very, very difficult.
Yeah, I think we're working on, this is year 2 with the mini and dealing with this. So it's like, I see those pill bottles come in Amazon, and she's like, "We just ran out." And I'm like, well, "Are we still doing this?" And she's like, "Yeah, we're still doing it." I'm like, "Wow." I don't want her to take the path that her mom did, but she had some twisted guts and stuff that Pepper did.
Yeah, she did colic, but we were definitely having some feet problems with her. For sure. She was laminitic, and every time the breathing stuff would get out of control, then we're starting to have feet problems again.
Yep. Well, the other thing too, all these things combining, and then you find out that, oh, by the way, COPD people are also much more prone to insulin resistance.
Right.
flat out without even the other medicines pouring in and making things worse. And like, well, how's that work? Well, it's just that the inflammation it's in the lung tissue creates interference with the normal action of insulin. The body starts pouring in more and more insulin. So a lot of these people, also, of course, weight, insulin resistance causes a lot of weight gain, and excess weight on the horse is going to cause more breathing problems. So you find out that you're really controlling COPD and insulin resistance at the same time to avoid the foot problems. It's just a gang tackling of very small, simple steps. Keep pushing it away. It's easy, but notice. I'm glad that you noticed it's there. You're going to do something about it, and it'll help. The other thing we find is that because of the broken cooling systems, these horses in the human weather now will just start puffing very, very hard. For no matter what you do. And so those horses we'll cold water hose them, scrape them, towel them off, put a fan on them. The respiratory rate will drop from 80 a minute to 30. It's still high, but it's much better. And people are like, and I'll tell them, I didn't cure COPD with a garden hose. Why is your horse so much better? Just because it's not cooking as much.
Right.
It's not struggling to cool itself. So with those particular horses, I used an old racetrack trick that veterinarians, I was one of them too. I would take Advil in the mornings when I was going to be down in Florida and working in Miami and Fort Lauderdale, and I would take it in the morning, and I would I'm cooling my body temperature 1 degree, and then so with these horses, we'll often put them on Equiox, which is a non-steroidal, but you can keep them on it for a longer period of time than butanbanamine. So when you know it's going to be 90. I'll just say, okay, that morning, give your horse some Equiox, bring his body temperature down a thing. And often veterinarians are called in these emergencies of my horse looks like you turn him purple, and you give him that steroid shot, and the horse is instantly better. And people are like, oh, great, we've cured this allergy disaster, allergic attack. No, you didn't. What you did is you dropped that horse's body temperature between 1 and 1.5 degrees with a steroid injection. So all of a sudden you've cooled him down instantly. He's going to stop breathing heavy, right? Horses pull off heat through their skin, about 80%. And then the other 20% is through breathing. And their skin mechanism is broken. So the only thing they have left is breathing. It's like trying to cool down like a dog.
I have a question that might be off topic here. The other day, my wife, she works 50% of her job here at the house, and then 50% she has to go to a brick and mortar building to do her actual job. I'm here on the property 24 hours a day. She came home the other day and asked if the horses were running in the field, the mare and the mini out there. And I said, not that I know of, because normally you can hear big horses, 1,500-pound horses, galloping and stomping the ground and everything. When we were going to feed that night, she noticed that the mini had a little bit of blood in the nose, and that's what led her to believe that they were running in the field. What would have caused that? I know this might be off topic, but you were talking about horses getting overheated and not being able to breathe and things of that nature. Is that something that might have caused a little bit of blood in the nose, the running around in the heat? Because right now in the Carolinas, we are sitting at I think we're at a high of 91 today. So
it's starting to warm up. It hasn't gotten hot yet.
Yeah, no, it's often sometimes the horses will break small blood vessels within their nostrils, and it's not really related down deeper into their throat or into their
come on in. Go over there. We're live on the air. Who's in the studio there?
Delivery.
That's fine.
Often that's just within the nostril. It's not really down into the throat or into the lungs. Because they're really usually not exercising that hard to get exercise-induced pulmonary hemorrhage like a racehorse.
Okay.
So most of the time that's not an issue, but it is just it's a bunch of just management, just trying to keep things in line with all these different steps. And they're simple and easy and they're cheap. So why not do them? Right. So
you know what it is. You say that now that it's cheap. As soon as those pharmaceutical companies figure out that we're giving this stuff to horses, those prices.
They'll put a picture of a horse on a bottle, and there you go.
This is only for horses.
Look what they did to omeprazole, right? We were given Prilosec tabs to horses. All of a sudden we had, wait a minute, there's omeprazole paste for horses. Yeah, but it's $50 a tube.
Yeah.
Right.
and the omeprazole was given these, was very cheap. So, yeah, that's a good point.
All right, we're going to take a quick little break and come back and continue this conversation with Dr. Frank Reilly. Stick around. You're listening to Equine Dynamics with Mike Stine. He'll be right back.
But rarely.
Well, you never know where
We have some general ideas. We just run with wherever the rabbit trails go.
Those are the best shows. If you stick to the path, sometimes you miss the scenes on the left and right that you might be missing. So,
Right.
Mike, you ready?
I'm ready.
Okay.
As long as Frank's ready, we're good. I'm never ready.
He's the special guest. We have to wait for him. And when he says go, we go.
That's right.
Welcome back to Equine Dynamics with Mike Stine, brought to you by Equine One. Get your hoof care needs over at Equine.1 right now. The natural hoof dressing, all natural hoof dressing, and also the hoof mender. Get 10% off your whole entire order with keyword podcast. So go over there right now. That's Equine.1 to our friends up in Canada. And I was just in Canada last week.
You were.
I was up in Vancouver, the other side.
You didn't go pet any baby bears.
No, I didn't pet any baby bears, and I didn't go see our friends over there at Equine One, but they're in, I think they're in the east side of Canada. I went to Vancouver, the west side of Canada. So that would have been a long walk for me to go over there. And joining us here in the studio as well is Dr. Frank Reilly. How are you?
There. Good morning.
So we were talking about laminitis and insulin resistant. Now, I know I've asked this question before, but we've only done 300 shows already, and I probably forgot the answer already. Can a horse be diabetic? When you say insulin, because both my mom and dad are both diabetic, and I have to be conscious about that. And you talk about insulin resistance as well. Is there something that we can give a horse to improve that, a shot or anything like that? Or is it just strictly maintain what they take in and what we give them to so they don't get insulin resistant? I guess, is there a shot, like we would do an insulin shot type deal? Is there anything like that in the horse community?
Well, I mean, that's a very good question. And often it's kind of misinterpreted as, years ago it was called, horse diabetes and things like that. And also called, horse pre-Cushing's. And we really did not understand why these horses were having laminitis. This is, even just 10, 15 years ago. And so there was a lot of misinformation coming around. And then a study out of Australia showed that it was actually the overdose, a large amount of insulin in the horse's body that was causing these problems. And so insulin resistance or insulin generated laminitis is now the number one cause of laminitis in horses. So now we know that it's through insulin resistance, which is basically the cells are not accepting the insulin that they should be taking in. And because of that, large amounts of insulin is continually rolling around the body, causing laminitis, causing actual hoof damage, and also irritating the nerves in their horses' feet. And so we now know that what it is. So your first question is, do horses get diabetes? The answer is no. They get the insulin resistant part, like in people, where especially in horses also, if they're overweight, where the insulin will go up high, but their glucose is normal. In your early stage diabetes, you're going to be getting insulin and glucose are high, and then eventually in late stage diabetes, glucose is high and insulin is low because you burn out your pancreas, and then you have to shoot insulin. So thank God we don't have to shoot insulin to horses. We'll never have to do that. Horses do not get diabetes in a true sense. Sometimes people get confused.
Like me.
They get, they think, oh, no, wait a minute, my horse does have high insulin and high glucose. I'm like, yes, but you have an overlapping of two diseases and it's creating that. For example, if your horse is insulin resistant, has a fever, fevers bring up glucose. So it looks like your horse has diabetes. It doesn't. It's just a temporary thing like that. Or my horse has insulin resistance and Cushing's, which could cause insulin and glucose to both be up, but they're two separate diseases. And so it's important that people know now there is no such thing as horse diabetes. That's not pre-diabetes like in people.
Go ahead.
It's just insulin being high, either due to genetics. Most of these horses are genetically prone to it, or their breed. Certain breeds are almost all ponies, all minis. They're going to become insulin resistant eventually. Certain like Morgans, Tennessee Walkers, Rocky Mountain horses, they're all more prone, where other breeds are less prone, like thoroughbreds and standardbred race horses, for example, are much less prone. A little more leaner, they exercise more, so they hardly get insulin resistance until maybe when they're older.
So how often should we check in their blood work? Because I know, like you and I and everyone else, we go to our doctor, our normal nurse practitioner or general practitioner, and they do it at least once a year, if not twice a year, if they're looking out for something. How often should we be looking at horses and doing blood samples to make sure that what we're doing is good for the next time that we have to do a blood sample?
Yeah, I mean, great question. Often I'll tell owners or counsel veterinarians, most of the time in the springtime, I'll do it one time a year because you've got the horse captured, because you're going to be doing a Coggins, going to be doing your vaccines. You don't have to, everything's easy and simple. It's cheaper.
Floating the teeth.
Multiple trips and all that. And so you've got the horse right there. All right, let's test his insulin. You've got a blood tube in his neck already. Just put another blood tube, attach it to it, detach and attach. So it's very simple. You can do a baseline insulin and those will find the very, very high insulin resistant horses. The problem is it will miss about 30% of the insulin resistant horses on a baseline. So it's a positive, but a negative is not a negative. Those horses, then you'll end up doing. We stole it from human medicine, flat out. A glucose challenge, where we squirt Caro syrup in the horse's mouth, a certain amount, usually 7 cc's per 100 pounds, and then test their blood in an hour. Their insulin will peak, and we'll see, are you really insulin resistant or not? They'll peak out between 50 and 60. If they're under that, they're not insulin resistant, or your program is working. If they're over, their horse's insulin resistance and whatever you're doing is not working.
Does a horse have like we have an A1C? Does a horse have an A1C that we need to look for? And if they do, what's that magic number that I know my dad, the reason why I bring this up is because my dad's living with us now because my mom passed away. So I'm constantly checking. He's, like I said, he's diabetic and he always wants to get his A1C down. He's floating around a 7. Of course, he wants to be like around a 5 or something like that. Does a horse have an equal thing of a A1C number that they're looking for?
The horses, it's just pure insulin.
Okay, so there's no outside reading outside that.
No A1C in horses, and so you're going to test that. Usually, you'll go to. I like to use the Cornell University, for example. They do the most testing of insulin in this country. They do a great job. They're extremely accurate. I like to avoid lab error. I use Smith and Jones local lab, and then we used another lab and another lab and another one. Labs can vary, so try to keep using the same lab each time. You'll test these horses in the morning. The normal to see is give them some hay, give them hay, and a little bit less hay than you normally do, so they'll run out a little bit. They'll be a little bit more prone to being able to see what the numbers are going to be. You squirt them with Caro in the morning. Don't feed them the grain till later. Caro them. That comes an hour later. You can squirt the Caro in their mouth. The vet doesn't have to stand there for an hour. He comes in, squirt at 8. He comes at 9. Tests done. You feed. You give him the hay. Give him the grain. Everything's good.
Bob's your uncle.
It's real simple. Yeah, it's real simple to do it. And it's relatively cheap. They're going to spin it. I like to keep a centrifuge in my car because I don't like to have the sample rolling around in the refrigerator 4, 5, 6 hours. Again, I'm creating variables then, and so I will usually just spin right there at the farm. I'll pull up my centrifuge, stick it in the little socket at the barn, spin it down, harvest off, and then I'm ready to go. I'll freeze it, and then I'll send it to Cornell the next day. They get results in 2 days. So I know exactly what's going on. Is it a good number? Is it a baseline number? Is it a challenge number? So it's very simple to find these horses, because what happens often is my horse had laminized 4 times and he keeps testing normal insulin, and you're like, well, that's cuckoo. That can't be happening. So you just say you're missing these in that 30%. You got to challenge your horse with some Caro, and all of a sudden it comes back at 200, 400. And then you're like, wow, there it is. Okay, we found it. It was hiding, and we just had to come out and get it. And so now we'll start your horse on a program for insulin resistance. So thyroid powder helps double insulin sensitivity, also very cheap. And I've used it a lot of horses, and the farriers love it because there was 2 studies I stumbled into. I can't say I was looking for them. Is that thyroid powder helps with nerve repair. And so all of a sudden these horses, their nerves have been crushed by the coffin bones squashing the vessels and the nerves in their feet. and just and irritating the nerves in their feet. So thyroid powder, 30 cents a day.
For now.
That's right.
For now. But it's a I'm going to do it. And then the fair is like, man, this horse is just so much better, and he's so much easier to work on. And we just keep him on it year round, and they're keeps their insulin down, helps with nerve repair, and the horse just gets better and better. Hoof quality goes up. So we're going to do that. Balancers with high protein. Yeah, that helps with breathing muscles, but also helps with, of course, with hoof quality. Hoof is mostly protein. So balancers are less than $1 a day in a 1,000-pound horse. I'm going to do it. You know, these where there's some supplementations that you can do, and then also management with these horses. If they're having trouble being on grass all the time, get a program, bring it down to normal. It takes about 60 days. I wish it was quick, but that's just the real world. I would test at 30 and 45 days. These horses were no better. They looked better, but their blood work was still bad.
Hey, Mike.
So I learned. It took a while to get it down.
Hey, Mike, have you worked on horses where people have done exactly what Dr. Frank Reilly was talking about, and you're like going, hey, you know, I've done my part and you've done your part, not you, meaning the owner of the horse. Have you seen that situation? Have you dealt with that situation out in the field where you're at?
Yes, I have. And I think that, you know, going ahead and treating them is a good call for most of these horses, for sure. Definitely think it helps, and need to treat them. If nothing else, you treat them as is, right?
Absolutely. If we think of and that's a good point, Mike. That I'd say 50% of owners are like, if he's showing the signs, and I'm kind of worried, and the mother had it and all this, and I'm worried about this horse and passing it on. I don't need a blood test, and so they'll just go, well, let's just do this. And it's very simple and easy. And inexpensive,
right?
You know, so you're talking again. You know, slow feeder hay nets are really great. You know, like they're cross hatched, like a tic tac toe. So horses eat slow all day, no gobbling. You know, it's like the 400-pound people where they're just always voracious. It's the same with these horses, and so you just slow them down with slow feeder hay nets. We're going to give them plenty of food. We're not going to starve them. They're going to get what they need. Just over a 24-hour period.
Believe it or not, my horses got real smart with those slow feeders. They actually take their head and smack the bag and watch all the hay drop on the floor and then eat it off the floor. You know, they don't pick through the thing.
Well smarted.
That happened. So what we were lucky. We had a lady that was down in Florida, thin air canvas, and so the basketball net, it looks like a slow feeder made of basketball netting. Is you know, they can kind of get through there and they can beat it up a little bit, and a lot of food can come out. The cross hatching is a little bit more difficult because remember they're eating through a 1.5 inch by 1.5 inch square.
No, they knock that thing right. They smack it around. They get a nice pile on the ground, and then they start eating. All right, guys, we're going to take a quick little break, and when we come back, we're going to talk canker. So stick around for that discussion when we come back. You're listening to Equine Dynamics with Mike Stine. He'll be right back.
By the way, my wife and daughter just went to did the Alaskan trip.
Oh, really?
Week. Yeah, they loved it. It's the old thing. My wife and daughter went to Alaska. And I got a hat. I got a hat with a big eagle on it. But they went into.
I had my hat in here somewhere. I guess I left it downstairs. I was going to wear it. Yeah, I got a hat too. So.
Yeah, it's a big bald eagle, and it says "I am smiling."
Did they do the cruise, or did they do like the train ride through Alaska?
They did the cruise through National Geographic. It's a smaller boat. It was 100 people.
Oh, wow. That's really small.
So they were able to kind of get into these rivers, maybe a little bit easier than the big ship. But they saw the whales, they saw the seals or whatever those were. I think it was seals.
Yeah, seals.
And then my daughter, they got a great picture of her. They did the polar bear plunge. We could jump off one of these Zodiacs.
Yep. No way. No, thank you.
Me neither. I wouldn't do it.
I was born and raised in Orlando, Florida, so my blood is still full of sand right now. So I'm not jumping in no cold water.
Ready.
Ready.
Oh. Yes, ready.
1, 2, 3, go.
Yep.
Welcome back to Equine Dynamics with Mike Stine, the #1 award-winning podcast. brought to you by Equine One. Go to equine.one right
Equine One, yes.
Equine One to get your natural hoof dressing and also
the right way they can see it.
hoof mender, as Mike's talking all over their commercial right now. Get their hoof mender putty and also their 100% natural hoof dressing with no petroleum products in it, which is awesome for your hoof care needs. Go to equine.one right now and get 10% off your purchase with the keyword podcast. Thank you, Mike. Excellent job. And don't forget, for every podcast we do, we have a matching video over on YouTube. Make sure you like and subscribe over there. And also, you can follow us on Facebook. That's Equine Dynamics, Mike Stine over on Facebook. Mike posts a whole bunch of different educational articles up there. So if you're a horse lover by any means, go over there and you want to further your education, go to Facebook, like Mike Stine over there, and you will see all the information. And over there, Mr. Information himself is Mike Stine. How are you?
How are you doing? And how are you doing, Frank?
Great, good.
And joining us here in the studio is Dr. Frank Reilly, Doctor of Veterinary Medicine. Thank you very much for joining us this week, Frank.
Yeah,
I should say Dr. Frank. He's earned the
Dr.
degree.
Frank.
I'll call him Dr. Frank. He deserves it.
Well, people call me special names too, you know, all the time.
It's usually a 4-letter word, I'm sure.
Yeah.
So speaking of 4-letter words, we're going to talk about canker. I know that's totally wrong, but anyways, I had to segue in there somehow. Yeah. So we're going to talk about canker. What do we need to know about canker this time of year? Now, you said before we talk about this, there's a lot of information, so you want to dedicate a whole segment to it because there is a lot of information that a lot of people don't know about canker.
Right.
So I'm going to turn this over to Dr. Frank Reilly and tell us.
We're seeing more of it out there than we have ever had.
So what do we need to know about canker this time of year? And like Mike says, why are we seeing so much of it now?
Well, I think one of the problems we had about, a good 10, 12 years ago was that fairs and veterinarians were seeing it, but the ability to really control it or even treat it was just not there. There was multiple things being tried, and caustics, and gasoline, and burning and cutting multiple times, multiple surgeries, and problems that had been there for 6 months to a year, even 2 years. I've had people, and the money they were spending was, I'd say the average sometimes about 2 years ago, people would call us that have been been working on it for over a year, somewhere around $20,000. And it was like, wow, just the multiple treatments for it. And canker basically is a disease on the bottom of the horse's foot. And it's a soup of problems where it's bacterial, it's papillomaviral, it's fungal, there's spirochetes, and there's proud flesh. And so one or two things trying to control it is just not possible. It creates a proliferative a breakdown also on the bottom of the horse's foot. It can become painful and go through the sole and then get into sensitive tissues. It bleeds a lot, and they can't be ridden, and the work that it takes can be these owners work on this horse for over an hour and a half a day, trying just to wrap it and do whatever they can to try to help it. And then maybe you suppress it, but it kept coming back. So I had a farrier friend, Dave Giza, and he said, "Hey, we're doing it for 25 years. You've been doing it for 25 years. You mean we can't figure this out?" I'm like, well, I just hadn't even thought about it. I'd had a couple canker cases, then there were complete flops in the way of treating them. And so we worked about 2 years, and the first year was a lot of trial and error, almost all error. But we made a list of what doesn't work. And then we realized some things that did work, put it together, and we could clear them in 60 days. And then later, Dave said, well, there's spirochetes and canker. Why aren't we using doxycycline like they use in spirochetes of Lyme disease? And I'm like, that's a great idea. So we started doing oral doxy along with topical powder on the canker on the bottom of the foot. And that cut it from 60 days to 30 days. So we can clear cankers in 30 days now, which was a big leap. And then we learned things that did not work. For example, hospital plates and covering this thing up and boots. We learned that it's just too wet. You have to keep this foot very dry, and then you'll have great luck with it. Something very simple. So a lot of times pastes and creams were really struggling to work. And then also being gentle on your surgery when you're removing it. It's like a mushroom because there's proud flesh. It just pops up and continues to pop up. You cut it and it keeps popping up unless you treat it. But then people would, well, I'm going to get this mushroom, and instead of cleaning it off like flat on the ground like a mushroom and along the earth, they would just try to dig down in it, and it would just cause terrible damage. Just all the normal tissue was being obliterated. And so we learned that, don't be kind of, I would say, savage with your debriding. Just plane it down to normal tissue, flat. Don't try to go under, don't pothole it, don't concave it out. Just flatten it. Let the powder have a chance to get in there, which has been helpful. And then also, no caustic chemicals. People started using, pure Clorox and diesel gas. I mean, absolutely was used, and just all sorts of very odd concoctions. And I've had some cases in Europe where they just had literally removed the entire frog. And I'm like, oh my God, we've got so much tissue we're gonna have to rebuild here. And then after that, they used hydrochloric acid, and
wow, that's getting.
It was bad. I mean, first of all, it's the dangers around people and splashing your face has been, and so we got some powder to them. It did help, and the horse did. The canker was really pretty much obliterated by the hydrochloric acid, and it did. We started bringing it back normal tissue, but then the horse got very, very lame, and I'm like, something's not right here. Get the vet. And they came over there. They took an X-ray, and horses in massive laminitis and necropsy showed that the caustic chemicals, of course, had just destroyed all the tissue in the entire foot. So we learned things that work and don't work, and so we don't do the things that we bombed out on. And I'm very upfront with farriers and veterinarians. Look, I must well tell you that my flops and my failures, because there's no sense in you doing the thing all over again. Right. So I'm more happy to tell you the triumphs and tribulations, but at the same time, here are the things we tried. We tried, every soap on the planet. We were rinsing them in Listerine. David developed a thing, he patented, it was brilliant, like a shower drain with the little holes in it, and then it would come up, and it was washing out the canker, and all this was wonderful. But then we realized the horse's foot was always wet, and nothing cured in a wet foot, a stopping wet foot. So we learned, okay, we got to do a powder. What do we put in this powder? What's going to work? What's not going to work? And then I'm on our website. We put what we put in the powder and why are we doing this and these sort of things. And we've been very successful. We actually do several veterinary schools now that use the powder. And then the thing I've learned too is that I don't send the powder to owners. Let's say my farrier says I got canker and they order online, and I'm like, well, we're not doing anything. We have to talk to your veterinarian. I don't have a license in Iowa or Texas or Florida, so I have to make sure that they're okay. We need them on board. We need them giving antibiotics orally, doxycycline. We need them also then afterwards. The big problem we learned, I wish I would say it, we thought of this early. We did not. We probably were about 15 years into it. And then people started asking, a farrier said, well, let me get this straight, Doc. You're going to clear the canker. Yep. And then we're just going to wait around, get punched in the face again. If it comes a great visual, right?
Yeah,
what happens?
I think it's a great, it's a great question. What are you doing? Number one, what are you going to do to clear it? Got that part. Okay. What are we going to do to make sure it doesn't come back? And so we're thinking, okay, canker is very similar to EPM in horses in that it's universal exposure. All horses are exposed to EPM. All horses are exposed to canker. It's in the soil of everything, all fields,
right,
all over the planet. Not even islands. I've treated horses in Hawaii with canker, so there's no place you're not going to get it. And I had a lady in the UK. She was in tears. She's like, "Oh my God, my veterinarian's saying that I have to move from my farm because my soil's contaminated with canker." I'm like, well, "There's nowhere to go."
Yeah, it's all over the place, sister.
It's all over the place. Yeah, so what are you doing? Just stay there. We'll manage it. And then the thing is, a field of 10 horses, only one gets canker, or 20 horses, only one. So it's only, you're like, well, they're all exposed, but only this one gets it, like EPM.
You think it has anything with an immunity deal or anything like that? What would flare up?
Absolutely. We're either missing something or we don't have it in this particular horse. We don't know what. And so the farrier's punch in the face thing was like, okay, well, what are we going to do for immunity that's reasonable for these horses after we do it? And so we decided, like, well, let's just do what we do with EPM, and same thing so high dose vitamin E, thyroid powder, which is an immune stimulant, and then make sure they're dewormed correctly. A lot of these horses are not dewormed correctly. That people say I've had a fecal test and it's negative and I haven't been wormed in 2 years and all that nonsense. I'm like, well, horses have approximately 10 parasites, but fecal tests only pick up 2 of the 10. 2. So all of a sudden you can be packed in tapeworms, right? And all these things, packed in bots in the stomach, and you're going to have a negative fecal, and your horse's immunity is dropping, right? It's a huge load on knocking down their immunity. I'm like, let's get on a good deworming program. Let's, 3 times a year if you're in the South, twice a year if you're in the East. Cheap and easy, $20. Come on, what are we doing here? And they're like,
not a big deal.
Now, you were talking about, the lady said that she had canker in her fields. I'm a yard guy. And, being from Florida, I learned a lot about, like, the agricultural and the landscape and everything like that. I know if you have nematodes in your yard, if you put sesame oil in there, it'll kind of take those nematodes and shoot them in the neighbor's yard. Is there anything that you can put on your yard, like a powder or lime or something like that, to keep the canker from being as prolific,
prolific.
Prolific. Let's say that word.
Okay.
Thanks,
well,
Mike.
We'll just make up words as we go.
We got a whole
That's
dictionary.
What I do.
Yeah, a whole dictionary.
As long as they don't know, it's not a problem, right?
We have a whole dictionary full of words we make up. Is there anything that I can put on my yard to kind of lessen the likeliness of getting canker? Like when you say it's all over the place, is there something that we can maybe start at quote unquote ground level?
Well, one of the probably biggest generators, how does this start usually, is probably the papillomavirus, and that is transmitted usually across all everywhere by flies, and so it's very difficult to try to eliminate probably the main generator of papillomavirus. It'd be a great thing if you would just spread something in your fields and knock it down. Nematodes and worms are one aspect in one case of that they thought it was a generator of canker. So that's another reason why when we start our treatment, we put them on ivermectin once a week for 4 weeks in a row. So that's a very good point. I'm glad you brought that up. So we're doing everything we can to make sure that get it cleared so we can get it clear. But it's just a matter of making sure it doesn't come back, and
right.
And because it's so expensive, like I said,
a lot of times when it comes back with a vengeance.
Twofold, because you already knocked it down once. It's like, I'm back in the round 2. I'm going to knock you out now.
We just pissed it off.
Yeah.
Well, that which is a hallmark of cancer, right?
Right.
And so in Europe they used to call it, hoof cancer, which is of course scary and an awful term. And
both words.
Right. It's not accurate because there's papillomavirus in there, and that can cause certain types of cancers. But you're missing the fungus and the bacteria and the spirochetes and the proud flesh. So calling it hoof cancer is really not quite true. One thing that we're really is in the last 2 months that's kind of been surprising is we had a couple of cases where we treated them 2-3 years ago, and they're saying this horse's frog, there's a little area the size of a dime or nickel that looks kind of cankerish. I'm like, well, you're on the prevention program. We've never seen this before. And then all of a sudden it was another one and another one all around the country. I'm like, what are we doing? So I said, send me pictures. And when they would send a picture of the back of the frog, they were also getting the heel. And then we realized that wait a minute, there was this crusting over the heels coming down from the coronary band, and they call it kind of CBD or coronary band dystrophy or coronitis. And there's really almost no literature about it and what to do about it. And one of the things was a guess was to use very high dose steroids to try to knock it out.
Right.
It was some sort of a autoimmune problem.
Yep.
But the problem was when we would talk to people with these problems, they're like, "Oh, doc, we tried that, and it just caused raging canker in all 4 feet." Oh,
yeah.
Of course, steroids increased papillomavirus. So all of a sudden you're like, well, no wonder. And then all of a sudden they're saying, "Oh, we're getting sarcoids on the horse's belly or in their ears." Well, those are those are country cousins of papilloma.
Yeah, Mike, you were going to say something?
I'll say one of the worst cases I have seen. They had been treating it with salad dressing. Well, no,
Ranch or creamy Italian? Because that's my favorite.
Had been messing with this for about 4 years, and they were mixing up something, and they were making up their oil. They were putting some tea tree oil in it.
What backwoods people are you taking care of, Mike?
About, every so often we use a little bit of lemon juice in it.
Sure. Make a Caesar salad while you're at it.
And by the time I got the call, I said, okay, this is great. Call this vet. We work together. Well, why you need a vet? You better have a vet. This is not territory if Harry needs to go walk in and say, I can fix this, because you're getting in deep. But it was growing out of the coronary band on the horse. And
so technically they were feeding this.
No. They were making up salad dressing and putting it on the horse's foot.
Right, but it was actually making it grow twice as fast. No?
Right. They were using, I think they were using like a good olive oil.
Paul Newman's.
Because they wanted, good quality stuff, putting some tea tree oil in it. And occasionally, like once every 4 months, they would treat fresh squeezed lemons into the oil, and they were painting it with it. Mm-hmm. And I was like, you're making salad dressing.
Yeah, it's not good. Not good at all.
But we don't want to do. And by this time, it's a huge disaster in all 4 feet, and we've got to have it fixed like next week.
Yeah, of course.
Don't play with this thing. If you've got traces of it, get on it early.
All right.
Absolutely. Yeah, early is pretty simple, or if it's 1 or 2 feet, it's pretty simple. Right. It gets into the 4 feet, and then it's been going on for 3 years. Like, oh, okay, well, it's going to be a lot of time and effort.
Uphill battle.
Yeah,
right.
Yeah.
I don't have anything against tea tree oil, but sometimes you need to do something. Yeah,
no, I mean, again, you got to be careful. Some of those essential oils, if you put them on straight, they'll burn.
Right.
So,
I think that was why I'm mixing it with olive oil.
Oh,
throw Popeye in there too while you're at it. All right, guys, we're going to take one more little break and come back and wrap up the show of what we learned and all the information for how you can get a hold of Dr. Frank Reilly when we come back. Stick around. You're listening to Equine Dynamics with Mike Stine. He'll be right back.
About as okay as I can be. You hadn't got much to work with here. You know that.
You look good over there, by the way. Frank, you look good too.
Yeah, well. Just make sure when you're editing the video, right?
Show the good side. Yeah, I'll put the what's the slimming filter on there. Yeah,
if there is such a thing,
I'll do the best.
You'd be amazed what they can do with these filters these days. He can make me look good.
Welcome back to Equine Dynamics with Mike Stine, brought to you by Equine One. Equine One is where you can find your Mr. and Q here.
I'm slow.
You can find your all natural hoof mender putty and also all natural hoof dressing.
Right angle.
Yep, right angle. And you can see these over on YouTube. For every podcast we do, we have a matching video over on YouTube. Search Equine Dynamics Mike Stine and get 10% off your order of all your hoof care needs. Go to equine.one and put in podcast for 10% off your order. Thank you, Mike. Good job. And don't forget to follow Mike Stine over on Facebook as well. And also, if you have any questions for Mike Stine, or if you'd like this podcast to perform at your clinic, out at your location, if you got a barn with people in it, you're going to want us to be out there and do this show just as you see it here on YouTube. Go to equine.com and fill out that little form that says contacts. And put a return address in there as well, and we'll send you a little prize pack. And over to my far hand side, my very own prize pack is Mike Stine. How are you?
I'm doing good. How are you, Travis? And we are really lucky to get Frank on with us today.
Yes, and joining us here in the studio with so much information that has been given to us, and being very kind of joining us this week is Dr. Frank Reilly, Doctor of Veterinary Medicine. Dr. Frank, how are you?
Good morning. Great. It's been a pleasure.
So you've given us so much information from how important COPD and asthma and breathing affects the horse's feet. So we're going to go back over what we learned when we were discussing that. Is there anything else that you want to add to what we might have missed, or anything on that, or the importance of it?
Well, I'd say the first important thing is it is a gang tackling of management and medications. And it's very important to do all these things at the same time, and to understand that certain medications can be very effective and helpful for very short periods of time. like steroids and bronchodilators, but you can't be on them for a very long time. They're kind of just rescue medicines, and you have to get off them as fast as possible. And then and understand that their importance of generating insulin resistance, and COPD itself creates insulin resistance. And so you have to know that it not only is a breathing problem, it's a foot problem.
And how are we dealing with insulin resistance now as of 15 years ago?
Well, I think the wonderful research that's come out around the world, that we now know that high insulin is the number one cause of laminitis in the world, not just this country. And so, and also through that is connected, even if it's a sickness like salmonella and other things that our horses were used to get laminitis, we now realize that bacterial infections also cause insulin resistance. So all these things that we used to think were independent causes of laminitis, it's like a bicycle built for two. Insulin resistance is on the ride with you. So if you have to have the information and knowledge to lower that and understand that, to test if you think you've got the problem, and then move on to management, very simple steps. Such as feeding programs and slow feeder hay nets and thyroid powder. And all these things together can come together to actually lower your horse's insulin, protect their feet, avoid the laminitis. Don't react to a sore horse, prevent it. And you can prevent it.
And also, why are we seeing so much canker this time of year? And why is it popping up so much now in the present than it has in the past?
Well, the problem of canker is universal. It's worldwide, and so at first everybody thought it was because it was a problem of dirty barns and bad management, not picking their feet out, and
Right.
being in a mud bowl and all that. Well, let me tell you something: the best show horse in the world get canker, and these things are up to their knees in shavings and getting horses' stall picked out 10 times a day. It is not a management problem; it's an immune problem. We don't understand fully what it is. But we're in attempts after treatment, we're doing immune stimulations to avoid it from returning, and that's very important. And then the canker is going to be first seen by the farrier almost 100% of the time, right? Something's wrong here, and so I think Mike touched on it's definitely going to be a team effort. The veterinarian and the farrier are going to have to work together to get it cleared. You can clear it,
Right.
And it's relatively simply. Avoid caustics and avoid 10, 15 surgeries. It's silly, but it is absolutely, Mike's absolutely correct. It is more. I think it's recognized more. Maybe that's where we're seeing it more. But it could be that maybe the papillomavirus levels in fields, maybe that's up. I don't know.
Right.
Mike, you were going to say something?
Well, yeah, I mean, that's another thing, Frank. Everybody says, well, that's a draft horse thing. And I've seen it in quarter horses. I've seen it in Arabians. I've seen it in thoroughbreds. And
You haven't seen it in my horses, have you?
I have not seen it in your horses.
Yes.
But it's across the board. I feel like we're seeing more of it.
Yeah,
than we have.
absolutely have. We were starting out with probably doing 50 cases a year,
Right.
And we're probably up to 300 cases a year. I'm getting a canker case almost daily.
Right.
And,
See, when you say
that's a big jump.
when you say 300 cases a year, that's United States, right?
Yeah, we're worldwide, and so people will contact us, and then we'll set up a management program. We'll contact their veterinarian, and we'll try to get everybody coordinated and the farrier. How are we going to do this? What's going to go on, and all that. And I think that the fact that maybe there's a relatively easy and simple answer. That powder, it's one of those things that we make it just about a cost, because people are exhausted financially and they're exhausted physically wrapping these horses for years, and they're about to give up. They're about to put them down, and they're like, if I tell them, it's something another $1,000, I can't do it.
Yeah, if you catch some of these things early, it doesn't have to be much of a deal.
No, it can be. You can clear these horses for just a couple $100. So it can be done. When you start getting into 4 feet, it's expensive, and trying to do it, because it's going to take multiple buckets of powder to try to get that thing knocked out. But a bucket will do 2 feet. and that's relatively inexpensive. So
Right.
So how can our listeners find out all the information and where they can get this powder, your powder, Dr. Frank Reilly's powder? How can they get in touch with you? Facebook page, website, all that stuff.
Yep.
Yeah, let
Yep.
our listeners know.
So we have our office number in Pennsylvania, 610-436-5174. And then also we have our website, Equine, EQUINE, MedSurg, MEDSURG, equinemedsurg.com. And then our email is equinemedsurg@equinemedsurg.com. So it's very simple to get back with you. And I always think that a 5-minute talk is worth 100 emails. So we'll start off with emails, but we always have to talk to people
Right.
On these problems, because you find out things that you just can't get in an email.
Right.
So it's important, direct communication with us, and then we do direct talking communication with your veterinarian and your farrier. I'd say the farrier we probably talk to probably 85% of the time too. So you've got to, in all the problems we've seen when you go to conferences about how to help with communication between veterinarians and farriers, I think the top is direct talking on the phone beats nothing.
Right.
I mean,
And,
it's great.
that is definitely one of my pet peeves when you're working on any case. I want to communicate directly with veterinarians. And if they're not really working with me, and things, it's like playing a game of telephone. By the time you get it back through this one and this one and this one back to you,
It's all wrong.
Too much stuff's misconstrued.
Yep. Yeah, trying to do it all through the owner or all through the vet, or it gets all diluted or backwards. And so,
Right.
It's that 5-minute talk to each one of those professionals. I just call them there's only 2 horse care professionals in the barn, right? The veterinarian and farrier.
Right.
So they should be talking direct.
All right, we'd like to thank Dr. Frank Reilly for joining us this week on equinedynamics.com. Don't forget, you can follow us over on YouTube. Search Equine Dynamics Mike Stine over on YouTube. Give us a subscribe over there, and you can see all the fascinating stuff that we have going on here in the studio. And make sure you follow Mike Stine over on Facebook. Same thing, Equine Dynamics, Mike Stine. And if you have any questions for Mike Stine, or if you'd like us to perform a clinic or this podcast out at your location, go to equinedynamics.com and fill out that little form. Make sure you put a return address, and we'll send you out a little prize back and stuff. On behalf of Mike Stine over there,
Thank you. Enjoy your ponies and have a good day. And thank you, Frank.
All right. Well, thank
Always
you for
a
having me.
pleasure.
Enjoyed it.
we'd like to thank Frank Reilly for joining us this week. My name is Travis saying see you next week.
All right.
All right, so there you go. But the main hub is off.
Thank you very much for your time.
No, that went very well. You guys are, you're easy, and it was, like I said, it was fun and funny.
Well, I'm the funny part. He's the easy part.
That's right.